Hello everyone, this is Dr. Sam and this video is about liver ultrasound probe positioning. On the left side, we have a schematic representation of probe placement, and on the right side is the corresponding image. This white box is the ultrasound probe. The red dot is the indicator or the orientation marker. It is facing towards the right side of the patient. These dotted lines represent the right and left costal margins. This is the umbilicus. The patient is in a supine position. The probe is placed in the midline in transverse orientation, just below the costal margin, and you will see the left lobe in transverse view. This is the left lobe, and we can also see the left portal vein. It has a hyperechoic wall. This bright line is the ligamentum venosum, and posterior to that is the caudate lobe. If there is difficulty in visualizing the left lobe, ask the patient to take a deep breath. Next, rotate the probe 90 degrees clockwise. Now the indicator is directed towards the patient's head and the probe is in longitudinal orientation. Move a little to the left of the midline and scan the left lobe thoroughly all the way to the edge of the liver. You will also see the pancreas posterior to the liver. This small, round, anechoic structure is the splenic artery. This large, rounded structure behind the pancreas is the splenic vein. The stomach may also be seen. It will look like a structure with alternating bright and dark layers. Now move to the right of the midline and you can locate the caudate lobe of the liver. This is the caudate lobe, right behind the ligamentum venosum. This large vessel is the inferior vena cava. It is the IVC because it is to the right of the midline. This is the hepatic vein draining into the IVC. This anechoic structure is the superior mesenteric vein. While staying in longitudinal orientation, move further to the right of the patient, just below the right costal margin. You will start to see the porta hepatis around this area. It will be seen in the middle of the right costal margin approximately. Locate the portal vein and its entry into the liver. This is the portal vein with hyperechoic walls. Then rotate the probe slightly anti-clockwise until you see the common bile duct. It will be anterior to the portal vein. This is the common bile duct. You can measure its diameter in this view. Move even further to the right side of the patient while keeping the probe slightly rotated anti-clockwise, and you will see more of the right lobe of the liver. Sweep left and right to scan the right lobe completely. You will see the gallbladder, portal veins, and the hepatic veins. Keep going right along the costal margin until you can see the kidney. Usually it is seen at mid-clavicular line. This is the right lobe. This is the right hepatic vein. We can see both the upper and lower poles of the kidney. This band is the psoas muscle. Scan all the way to the right edge of the liver. If needed, ask the patient to take a deep breath. This will push the liver below the ribs. Now we will see how to scan the hepatic veins. Place the transducer parallel to the right costal margin and place it just below this costal margin in transverse orientation. Then ask the patient to take a deep breath. After the breath hold, angle the probe towards the patient's right shoulder and scan the liver under the costal margin. You will be able to see all three hepatic veins. This is the left hepatic vein. It will always be in the right half of the image. This is the middle hepatic vein, and this is the right hepatic vein. The right hepatic vein will always be in the left half of the image. All three veins are draining into the IVC. These are the portal veins with hyperechoic borders. The gallbladder is seen here. Aligning the probe in similar manner, ask the patient to take another deep breath and sweep up and down while angling the probe towards the patient's right shoulder, and you will locate the porta hepatis. This is the liver in transverse view at the level of porta hepatis. Here is the portal vein and the CBD anterior to it. The inferior vena cava is seen in cross section. After another breath hold, move inferiorly along the costal margin while keeping the probe parallel to the costal margin, with slight angling towards the patient's right shoulder. You can scan the right lobe in transverse view and you will also see the right kidney. This hyperechoic structure is the renal sinus fat. This is the gallbladder, and this small anechoic structure is the IVC. There are some differences in individuals regarding actual locations of these organs, so probe positioning and protocols may be a bit different in different patients. Hello everyone, this is Dr. Sam and this video is about gallbladder probe positioning. With the patient in a supine position, start by placing the probe in the mid-clavicular line in longitudinal orientation. The position of the gallbladder is variable, so there are some differences in probe placement. Scan the right upper quadrant until you locate the gallbladder. You will get this type of image. The liver is used as a window to scan the gallbladder. This rounded structure with hyperechoic walls is the portal vein. And over here is the inferior vena cava. You can rotate the probe clockwise and anti-clockwise to scan the gallbladder after it is located. Keep the indicator facing towards the patient's head or the right shoulder. You can also angle the probe forwards and backwards to evaluate the gallbladder. This is the image we will get here. This is the liver just below the costal margin and anterior to the gallbladder, and the gallbladder is seen in a longitudinal view. Normally it has a vertical position. The fundus is facing the patient's feet and the neck is facing the patient's head. That is why we see it like this on ultrasound. The IVC is also in longitudinal view. If there is difficulty in scanning, you can ask the patient to take a deep breath. This pushes the liver and the gallbladder below the rib cage and is easier to visualize. To view the gallbladder in transverse view, rotate the probe 90 degrees anti-clockwise in the same location and you will get an image like this. We can see a little bit of the liver. Some rib shadows are also present. These are bowel gases causing dirty posterior shadowing. You can also use an intercostal approach to view the gallbladder. Place the probe between the lower rib spaces in the mid-clavicular line with the indicator directed towards the patient's head, and you will get this type of image. Rib shadows are seen here and here. This is the right lobe of the liver, and the gallbladder is seen inferiorly at the right side of the image. This is the portal vein with hyperechoic borders. If you see too many rib shadows, you can rotate the probe anti-clockwise to direct the indicator towards the patient's right shoulder. You can also rotate further to fit the probe between the rib spaces, which can clear the shadowing and you can scan the gallbladder. Another patient position for gallbladder scanning is the left lateral decubitus position. Roll the patient to the left side and place the probe in similar manner around the mid-clavicular line. The gallbladder is brought forward and the bowels are moved away from it, which makes it easier for scanning. This approach is very helpful in distinguishing between mobile and non-mobile gallstones or sludge. Always try this approach if you find gallstones, sludge, or polyps. An erect patient position is also used in some cases with the same probe placements. Hello everyone, this is Dr. Sam and this video is about pancreas ultrasound probe positioning. Place the patient in a supine position with the indicator directed towards the patient's right side and start by placing the probe in the midline in a transverse orientation below the costal margins. You can use the left lobe of the liver as a window to scan the pancreas. A water-filled stomach can also be used as a window for scanning. By placing the probe in this manner, we will have this image formed. Look for the splenic vein and portal vein confluence. Then you will find the pancreas anterior to the splenic vein and the portal vein confluence. Next, angle the probe forwards and backwards to thoroughly scan the pancreas. The head of the pancreas is in the left half of the image. This is the body in the middle, and the tail will be in the right half of the image towards the spleen. To scan the pancreas in a longitudinal view, rotate the probe 90 degrees clockwise in the same location. We will get this image. The left lobe of the liver is seen. The pancreas is seen under the liver right here. This hyperechoic structure. This anechoic rounded structure will be the splenic artery. This structure behind the pancreas is the splenic vein. This vessel is the superior mesenteric artery. You can move the probe left and right to scan the pancreas completely. If you find difficulty in imaging the pancreas, Roll the patient to the left side in a left lateral decubitus position. This moves the bowel gases away from the pancreas. Then you can place the probe in both longitudinal and transverse orientations to scan the pancreas. You can also ask the patient to drink some water to fill the stomach. This water-filled stomach makes it easier to scan the pancreas as the stomach gases are removed. Hello everyone, this is Dr. Sam and this video is about kidney ultrasound probe positioning. Roll the patient 45 degrees onto the left side and place the probe in an oblique orientation through the lower rib spaces. This is an intercostal approach. Ask the patient to take a deep breath and hold it. You will get this image. Right kidney is scanned through the liver. This is the upper pole of the kidney. It will be always seen in the left half of the image. And this is the lower pole of the kidney. It will be seen in the right half of the image. This interface between the liver and right kidney is a potential space called Morrison's pouch. In case of ascites and trauma, you may find anechoic fluid in the Morrison's pouch. This hyperechoic border of the kidney is the renal capsule. The hypoechoic outer parenchyma is the renal cortex. The inner region is more hypoechoic. This is medulla, consisting of renal pyramids. The central hyperechoic region is the renal sinus fat. Behind the kidney, we may sometimes see this muscle. This is the psoas muscle. If you find difficulty in locating the kidney, angle and move the probe through the rib space. You can rotate slightly anti-clockwise to fit the rib space and remove rib shadows. You can move the probe more to the right if too many shadows are obscuring the kidney, and try a posterolateral approach. To scan the right kidney in transverse view, rotate the probe 90 degrees anti-clockwise in the same location as shown in this diagram. The probe is still slightly in oblique orientation. Then ask the patient to take a deep breath and hold it. This will be the image formed. The kidney is seen in transverse view. Here is the renal capsule, the hyperechoic border. This is the cortex, and these are the renal pyramids. If there are bowel gases obscuring the kidney, ask the patient to push out the abdomen. This moves the bowel gases away from the kidney. Now we will see how to scan the left kidney. First, roll the patient 45 degrees to the right side. Then, place the probe in oblique orientation through the lower rib spaces for an intercostal approach. The 11th intercostal space is a good landmark to locate the left kidney. Ask the patient to take another deep breath and hold it. The left kidney is higher and more posterior than the right kidney, so try a more posterolateral approach. We will get this type of image. The spleen can be used as a window to scan the left kidney. We can see the renal pyramids more clearly in this image. The psoas muscle is also seen here. Next, rotate the probe 90 degrees anti-clockwise to scan in transverse plane. Using the same breath hold technique, we will get a transverse view of the left kidney. We can see the spleen here. This is the renal cortex with hyperechoic renal sinus in the middle. Hello everyone, this is Dr. Sam and this video is about spleen ultrasound probe positioning. For scanning the spleen, roll the patient 45 degrees onto the right side. A supine position can also be used. Then place the probe in the 9th intercostal space at the anterior axillary line. When you place the probe through the rib space, this image will be formed. Below here is the diaphragm and this is the spleen. Right here is the hilum. Move the probe anteriorly and posteriorly to thoroughly scan the spleen in longitudinal plane. Next, rotate the probe 90 degrees anti-clockwise to scan the spleen in transverse view and move the probe anteriorly and posteriorly to completely scan the spleen. A breath hold is not needed, but if there is difficulty in scanning the spleen, you can tell the patient to take a deep breath and use the breath hold to scan the spleen. Hello everyone, this is Dr. Sam and this video is about appendix ultrasound probe positioning. The appendix has a variable location in the right lower quadrant. Use a high frequency linear probe with a frequency between 7 to 12 MHz. In patients with a larger body habitus, use lower frequencies and you can even use a curvilinear probe. You can start by placing the probe lateral to the umbilicus in transverse orientation. In case of suspected appendicitis, place the probe over the area of tenderness. This helps in locating the appendix much faster. The patient can help you in placing the probe over the area of maximal tenderness, but this method is not always reliable. Next, apply graded compression to displace bowel gases and locate the psoas muscle by keeping the probe in this manner. You will find the psoas muscle around here, and this is the dirty shadowing due to bowel gases, and you can also see some bowel loops. Move the probe laterally to the right of the patient to locate the cecum. Here we can see the abdominal muscles in cross section, the external oblique, internal oblique, and transversus muscles. And below these muscles we can see the cecum. It is filled with gas and gives us dirty posterior shadowing. The cecum will not have peristaltic movements, whereas the small bowel will have peristaltic movements. That is how you can distinguish a cecum from a small bowel. Move the probe down towards the end of the cecum. This is done to make sure we thoroughly examine right lower quadrant, and it helps us in locating the appendix. if it is not found up till this point. Both the cecum and the appendix have variable location. Move downwards and medially to locate the iliac vessels. This is the iliac vessel. This will be the image formed. Examine the medial and lateral aspects of the cecum. Usually the appendix is found near the psoas muscle and the iliac vessels. Adjust the probe accordingly, like this, near the umbilicus, until you find a target-shaped, non-compressible structure. This will be the appendix. The appendix can be distinguished from the small bowel by seeing the compressibility. The small bowel is compressible when we apply probe pressure, but the appendix is not compressible when we apply probe pressure. The appendix gives a target sign appearance in transverse view. Here is another image in the same location with slight adjustment of the probe. We can see the appendix, the tubular shape of the appendix right here. It is near the iliac vessel. After locating the appendix in transverse view, slowly rotate the probe 90 degrees clockwise to scan in longitudinal plane. This is the image of the appendix in longitudinal plane. This tubular structure is the appendix. Slightly adjust the probe in this area to scan the end of the appendix as well. Here we can see the blind end of the appendix. This is the expected location of the appendix. It has a variable location in different patients, so there is no fixed location for the appendix. The probe position and the location of the appendix shown in this video is for the location that is most commonly found, and it showed a normal appendix. An inflamed appendix is much easier to locate and scan. Hello everyone, this is Dr. Sam and this video is about bladder ultrasound probe positioning. To scan the bladder, make sure the patient's bladder is fully filled. Start by placing the probe midline in longitudinal orientation at the hypogastric region, which is also called suprapubic region, and you will get this image. We can see a fully filled bladder. Thoroughly scan the bladder by moving the probe left and right across the hypogastric region. Then rotate the probe 90 degrees anti-clockwise to scan the bladder in transverse plane. Move the probe superiorly and inferiorly to completely scan the bladder. This is how the bladder will look like in transverse view. Hello everyone, this is Dr. Sam and this video is about uterus and ovaries ultrasound probe positions. On the left side is a schematic diagram showing ultrasound probe position. These dotted lines are the right and left costal margins. This is the umbilicus. This white box is the ultrasound probe, and this red dot is the indicator or the orientation marker. This is the inguinal region. At this point is the symphysis pubis. For scanning the uterus, we place the probe between the umbilicus and the symphysis pubis joint. This is the hypogastric region. It is also called suprapubic region. Place the probe in the midline in longitudinal orientation. The patient's bladder must be full for transabdominal scanning. After locating the bladder, you will find the uterus posterior to it. Here is the endometrium and this is the cervix. You can also rest one end of the probe on the symphysis pubis to get better views of the uterus. Tilt the probe accordingly to scan the uterus completely. For scanning and measuring the endometrium, try to keep the probe parallel to the uterus. Heel-toe movements of the probe can be performed to align the probe with the uterus. This type of angling towards the patient's head is heel movement. For an anteverted uterus or anteflexed uterus, you can use the heel movement to align the probe parallel to the uterus. For a retroverted or retroflexed uterus, use toe movement. The probe is angled towards the patient's feet, and this will align the probe properly with the uterus. To scan the lateral aspects of the uterus, move the probe laterally towards both the left and right sides and you will get this image. This is the lateral aspect of the uterus. Now we will see how to scan the ovaries. The ovaries don't have a fixed position, but locating the internal iliac vessels is a good landmark to locate the ovaries. First, we will see the right ovary. Move the probe laterally and slightly oblique like this to locate the right ovary. We will get this image. It is showing the ovary in longitudinal view. In a similar way, move towards the left side to scan the left ovary in longitudinal plane. We will get this type of image. This is the left ovary. Next, we will scan the uterus in transverse view. Place the probe in the midline and rotate it 90 degrees anti-clockwise to keep it in transverse orientation. Tilt it superiorly and inferiorly to completely scan the uterus from the fundus to the vagina. This type of image will be formed. We can see the uterus in the middle and also the right and left ovaries on the sides. Now move laterally in this manner to scan the right ovary. By using the bladder as a window, you will find the right ovary at this location. You can rotate the probe in an oblique orientation if there is some difficulty in locating the ovary. Now you can move to the left side to scan the left ovary in transverse view. This is the left ovary near the uterus in transverse plane. Hello everyone, this is Dr. Sam and this video is about obstetric ultrasound probe positioning. We will talk about probe placements for a pregnant uterus. The only focus here is to scan the pregnant uterus and the embryo and fetus. We will start from early pregnancy. First, scan the uterus in longitudinal plane. We place the probe between the umbilicus and the symphysis pubis joint. This is the hypogastric region. It is also called suprapubic region. Place the probe in the midline in longitudinal orientation. The patient's bladder must be full. You will find the uterus posterior to the bladder. This is in early pregnancy. You can see a gestational sac here containing an embryo. You can measure the CRL after locating it. It is seen within the uterine cavity, so it is an intrauterine pregnancy. Rotate the probe 90 degrees anticlockwise to scan in transverse plane. This is the uterus containing a gestational sac in transverse view. Scan all the way from the fundus to the cervix. Make sure you examine the ovaries and head nexi as well by placing the probe in this manner in longitudinal plane. It is important to rule out an ectopic pregnancy even if you have located an intrauterine gestational sac, because in rare cases a heterotopic pregnancy can occur in which there is a presence of intrauterine gestational sac as well as a gestational sac outside the uterus. It could be in the fallopian tube or the ovary. As the pregnancy progresses, you will start to see the amniotic sac with the fetus in it. You can measure the CRL. The uterus is much bigger in size. This is the bladder over here. Fetal head and limbs will be seen well by the end of first trimester, that is at 13 weeks. By keeping the probe in this manner, we will get an image like this. In a longitudinal plane, the right side of the image is towards the cervix and the left side of the image is towards the fundus. On the left side is an image that shows us the position and orientation of the fetus within the uterus. It also shows the probe placement. And on the right side is the image formed when we place the probe in this manner. We can find out the fetal presentation and orientation. This is a cephalic presentation in which the head is directed towards the cervix. When the fetus is in this presentation, the head will be seen in the right side of the image and the feet will be found in the left side of the image. The spine faces the posterior aspect of the uterus, so it is a posterior spine and will be seen down here. We can also get a mid-sagittal profile here. It gives us great detail of fetal anatomy. In cephalic presentation, to view the fetal head and brain in transverse plane, bring the probe down towards symphysis pubis and you will find the fetal head. You can move the probe to the side until you see parietal bones on the top and bottom of the image. Adjust the probe slightly until you can see the thalami and the cavum septum pellucidum. When you find these structures, you can measure the biparietal diameter and head circumference. Move the probe slightly up towards the mother's umbilicus and you can locate the fetal orbits and nasal bones. This is the image you will get. Move the probe further upwards and you will find the fetal chest. You will be able to see the fetal heart. The spine is seen at the bottom half of the image. With small movements towards the umbilicus, you will be able to see the stomach on the left side of the fetus. This is the spine right here. Part of the umbilical cord is also seen. When you locate the umbilical vein like this, along with the stomach, you can measure the abdominal circumference. Another orientation is cephalic spine anterior. By placing the probe in this longitudinal orientation, we will get this image. The spine is seen at the top of the image. Now we can examine each section in transverse view. The heart will be seen like this, directed towards the right side of the image. Similarly, as we move up towards the mother's umbilicus, we can locate the stomach. The spine is seen at the top of the image. The stomach will be seen in the right half of the image. Next presentation is the breech presentation, in which the fetal head is directed towards the fundus and the fetal hips are directed towards the cervix. Fetal head will be located near the mother's umbilicus, and as we move down in transverse plane, we will reach the fetal chest. This will be the heart's orientation, directed towards the right half of the image, with the spine seen at the bottom. Move down towards the cervix until you locate the stomach. The spine is seen at the bottom and the stomach is also seen in the right half of the image. The next breech orientation is breech spine anterior. The spine is facing anteriorly. This is how the image will look like when you place the probe in this manner. The hips are directed towards the cervix and the fetal head is directed towards the fundus. For a transverse presentation, when you place the probe in longitudinal orientation over the uterus, you will get a transverse image of the fetus. If the spine is anterior, it will be seen at the top of the image. The stomach will be seen in the right half of the image. Similarly, the heart will also be seen in the right half. You can move the probe left and right to locate the fetal head and all other structures. This is another transverse presentation in which the fetal head is towards the left side and facing the posterior aspect of the uterus. So when we move the probe to the left, we will find the fetal head. When we move from left to the right, we will find the heart. This will be the image formed. If we move more to the right, the stomach will also be seen at this side. Transverse spine posterior position is another type of transverse presentation in which the fetal head is towards the right side and facing the anterior aspect of the uterus. So, keeping the probe in longitudinal orientation, if we move to the right side, we will find the fetal head in transverse plane. When we move the probe from the right side to the left side, we will find the fetal heart in this position with the spine at the bottom. Moving further to the left will bring the stomach in view, also at this side. In this type of transverse presentation, the fetal head is towards the left side and facing the anterior aspect of the uterus. This is an image of the heart. It will be found at this side. The stomach will also be found at this side. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.